Okay, let's go ahead and call a meeting. Oh. Oh. My clock says 4:01.
Working.
They may miss something. You don't want stereo?
That's what I was thinking. Or an echo, at least.
Why don't you reset that clock so it's the same as the one up there?
Probably set the alarm off on this.
Do give you special directions?
Okay, we'll go ahead and call this meeting to order and pledge allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, God, indivisible, with liberty and justice for all. Okay. We'll do a roll call.
Committee Member Horton,
Here.
Committee Member Grants, Committee Member Knowles,
Here,
Committee Member Jones. Here. Committee Member Schumacher. Here. Vice Chair Dalton
Here.
and Chair Ray. Here.
Okay. Well, thank you everyone for being here on this foggy, chilly evening or afternoon, how we call it. Go ahead and take a look at the minutes and if you looked at them, somebody can make a motion and a second on those.
I move to approve the minutes.
Yeah, and I second them.
All in favor?
Aye.
Nays? Okay. Both committee minutes are done. Do we have any visitors out there? No visitors. We're gonna have to turn the light on for them to chime in on these meetings. Yeah. I think that's part of the hard thing, you want that, but it's how you get people to take that. Same with city council, I'm sure, same thing.
So if you ever watch our meetings online on the Teams portal, there is a little option that if you can hit a button and it'll raise their hand. And so typically if I see that on my end, then I'll chime in and let you know.
Okay, thank you. Okay, old business was the Park Communication Board, and I'll let you talk that a little bit, Cicely, because you and I have changed some emails on that, so.
Just to give an update, we have raised $375 so far. There has been no traction on the GoFundMe. That's all been, or I'm sorry, there was one small donation through the GoFundMe, and then the rest has been directly through the city website.
Okay.
So,
And the rest of you, I'd encourage you to, if you've got individuals out there that would like to make a contribution to that, tax deductible, Cicely sent out one there, you go with, for me, it was the easiest way was the municipal pay site, because it just walked you through it really quickly.
mhm.
And I've reached out to a couple people, so I think you'll see some more
Okay.
coming in. I know I talked with Edwards Jones and gave them one of the little deals, and in fact, yesterday he said, "How do you get into it?" So I sent him the email so he could.
Okay,
So I'm sure that
perfect.
you'll see them contribute as well. And I know he reached out to the other branches of Edwards Jones, so we'll see what happens. So
Awesome. Thank you
that's all
for
we
doing
can do
that.
is go out and knock on the doors. So.
And if you need more cards or want a copy of it, I can send that out as well.
Actually, and I think Adam brought it up, a little bit bigger poster size one, if possible, because what
Yeah.
I'd like to do is take it to the businesses.
Sure.
I've talked to some businesses and the small ones, they don't really pop out as much, but if you could maybe even this size.
Yeah, we can definitely do that.
Yeah, I
that
think
would-
I actually have one formatted for that size already.
That
So
would
I'll
be
get,
awesome. That way they can display them. So,
Mhm.
all right. Thank you.
Is that anything that's been shared with someone at the schools that maybe works with kids that could really benefit from this and might have like funding source or something.
Not to my knowledge, but that's a great idea.
Yeah.
So yeah, we could definitely reach out to
See,
some of our
from what we
contacts.
have Christy that shows up, but she'd be a good one to,
Mm.
do you have her contact?
I do.
She'd be a good
Yeah.
one probably to send that out.
Yeah.
Too, because I'm sure even administrators in that would,
Mm.
might be a good one to even send to the superintendent of the school.
Yeah.
Probably another.
Well, even just gaining traction with some of the families that have kiddos that could really benefit from that. And
Yeah.
maybe they want to share it with their social media following and so on and so forth. And then bring
blow up from
more
there.
awareness to it. Yeah.
And actually, I was recently at an economic development conference and we did some tours in Lincoln City and they just constructed a huge accessible playground and they had one of the boards and that was just really nice to see. So it's cool.
Okay. Next on the agenda was just food resources, volunteering, community support, and I just kind of put that back on here to see if any of you have reached out and are doing anything in the realm of the community support. For me personally, I found it kind of interesting because during the meeting with the superintendent and the group, you know, I looked at it from a different angle, and I looked at it from, you know, rent reductions, heating cost reductions, you know, utility use, things like that, that could maybe ease them up for that month or next couple months, and that would give them more buying power towards food. And so I went after Pacific Power. It was kind of interesting because when I went through all their little trails, it brought me down to the CFC.
Mhm.
And I go, oh. So I do have an email, and I did get an email back from a CSC, but she's supposed to get back to me, their director, because that's something new for someone to propose to them because they do, you know, reduction for affordable housing and low income, but they never had it from the idea of a nonprofit needing that sort of help. So I'm kind of curious to, you know, what I'll see back from them, but I thought it was kind of a unique one. The other one I reached out to, and I came off my list of the health fair, was the Salvation Army. You know, I'm thinking, what other entity? And because I had met him personally, so I shot him out an email, and he got me one back the next day, and he was working, I think it was more with Shims. That was their connection with Shims.
Yeah, they do a bell ringing every year.
Yeah.
And Shem is one of the participants that does it. And in fact, I'm volunteering for Shem. And the money that goes into the kettle goes for the backpack program for the schools.
Yeah.
So anyway, we're
So like I said, there's lots of resources out there. Sometimes we just don't get our creative thinking. We always go back to the same ones, and yet there's those others out there that are in the wings that we don't tap them ever so
yes,
often.
Shem is getting a little bit of a break on the food that they're getting in that some of the food they have to pay for. And this month with all that was happening with SNAP, that the food pantry has gotten rid of the cost, the charging for 1 month.
Oh, wow.
So they're able to get more food and a bigger variety without paying, at least just for this month. But we had last week or the week before, we had 60 families one day, 50 families the other day before SNAP got reinstated.
Wow.
So we had a huge number of people and families of 6, 8, 10 sometimes. So anyway, but it's been better for them and we've been getting more donations in.
Okay.
And the senior center, I'm posting a bin for toiletry items, personal care items.
Yeah.
Because they hand those out too.
I know for our little church, we're doubling up on the amount of Christmas boxes, for instance, we give it out, you know, for the holidays, loaded up with, you know, all the boxes. I think for me personally, you know, going to the group that we had down there at central office with the superintendent was a reminder to me to step into that arena because you kind of forget about it sometimes. So, you know, put me getting my checkbook out and make some more. But I thought, you know, that's probably not a bad thing to kind of think about every year, not just wait for a crisis like what we had with the SNAP program. It's something that's there every year that we could, as a committee, could come back and, you know, bring that out to the forefront, especially during the winter seasons, you know, the holidays. So I think that was a good experience. Volunteering, I talked with Manna, same thing there. Volunteer is always the challenge. You know, how do you recruit volunteers?
Yeah.
Oh, I
Yeah,
thought the
we
new,
have-
I thought the new era did an excellent job. I
Oh,
think
yeah.
Scott just put in a wonderful
Yeah.
thing in the paper about volunteering and how we used to volunteer a lot more than we do now. And maybe we need to rethink or start thinking about that. So
I read an interesting article on that, was that today's generation is more bombarded with data and cell phones and computers and outside sources. And so they're not as volunteer minded as previous generations that didn't have all that data input coming at you all the time and trying to, access it. So it's kind of been a distraction for them. So
I had a similar reaction to Scott's editorial and sent him a note suggesting that maybe we could start getting into the high schools. And I know the med school has a whole program there. Dr. Davis is always looking for things for them to volunteer to do because it goes along with their semester assignments. And we might check with the high school. There may be a way to get the high school kids, just tease that part of your brain. And, once you graduate, oh yeah, I can do that, and get that generation going. So he and I are kind of going in the same direction. I had the same reaction, get a hold of someone from the school. And
along that same line, the leadership class and the Interact program is alive and well at the high school.
Yep.
And they are continually volunteering for different things that they don't ask for any credit or anything, but they're doing a lot of volunteering.
Yeah, we have a volunteer at Shem high school student who's been coming for months now. I don't know how many months, but anyway, he's awesome. And the senior center is looking for students to volunteer in the dining room.
Yep.
Seniors love having those young people in the dining room helping out with stuff. And last school year, we had 2 young ladies that volunteered fairly regularly, which was really nice.
I know when I was in high school, it was always a big deal to try to get to do stuff outside of school, because then you put it in your resume, and colleges were, oh boy, the busier the better. And I don't get that feeling anymore.
Well, we've had 2 students in the last 2 years that received full ride scholarships, one to U of O and one to Oregon State.
Yeah.
Full ride for 4 years. That's $160,000 worth of.
we need to market.
scholarships.
We need to market that.
It's very impressive. Both of them were Interact kids who had done lots of volunteering
Yep.
during their time in junior high and high school. So, yeah, the kids are a good source for labor, but the problem is a lot of the people want it during the school day and they can't always get off.
Yeah.
So we try and set up things on Saturdays so that they are available more often. It's amazing how many of them, though, have sports on Saturdays.
Yeah.
But
So does that particular group, the leadership group, do they get exposed to committees like us and others, or?
I'm not in charge of the leadership group.
I was just kind of
So
wondering how
I'm
they
not for
operate. I'm
sure,
not that
but-
familiar with them.
Yeah.
That might be something good for myself or myself.
Myself or myself.
Well, I was looking at her and thinking this poor girl's not that.
Yeah, she's not going to be,
But, to contact them to understand, maybe Christy could help us on that, to better
Yeah.
understand how that program works.
Yeah.
So, maybe we could have an influence of maybe even go and speak into that group at some point in time to generate their creativity and
Yeah.
thinking.
I think it more than possible.
Yeah. Okay. Leadership group.
Start with Terry Martin and then go to just get his blessings first.
Yeah.
And
Well,
then
it'd be good just to understand how that program works.
and you could talk to the 2 advisors for the leadership class and the Interact class.
I know I reached out to, trying to think, is it Jeannie? Samaritan, help me, Jeannie, Davis. I reached out to her, in regards to, because I know their students do a lot of volunteering. I haven't heard back from her. It's always, I have a hard time really connecting. She's probably so busier with her schedule, but I know they have a program where those students are looking for volunteers opportunities because it goes towards their education program. I think it's 3 hours a year or something like that. They are asked to do that. So I tapped her. So it might be something you and I could maybe you have a better insight to that one connection there that I don't have.
Well, I could check into it.
Okay, I'll talk to you a little more about it. It's just something I know that that one's always hard connection sometimes for, I know Dick and we both worked on that one. So
I know her well enough too, so.
yeah. So, okay. The next item on the list there is the Rotary presentation. I just want to touch on that. I know Larry and Wanda kind of work. I think you have a date set and all that.
We
so-
do.
Yes. Catherine Rukas, who is the suicide prevention coordinator for Samaritan, is scheduled to present at Rotary on January 6th. She wasn't able to attend the November meeting, so she and Larry have connected. The plan is in place for her to do a presentation on internal suicide prevention efforts at Samaritan, as well as her work with Tri-County Suicide Care Coalition. She'll start the presentation with general education and stigma busting around suicide to prepare the room. So that's in the works.
That's awesome.
So what time is it? On the 6th?
Lunch starts at 11:45, goes to 12:15.
You guys have the best food.
It's really good food. Yeah.
So if you guys
Kelsey
you
was-
can come down to and
I've gone to a couple.
Kelsey is, and her boss actually presented at Rotary, 3 weeks ago, 4 weeks ago,
Yeah,
something like
something
that.
like that.
So Rotary's getting a good turnout of people from the health committee helping out with their programs, because we're always looking for programs. And it's good to have.
Rotary's nice because you have that diversity and cross
Yeah.
section of leaders in our community and businesses. So it's a good place to tap on their shoulders.
Mhm.
And I encourage all of you to put that date on your calendar. And if you could come down there and help support that, I mean, I'll be glad to be there if I don't have anything else going on.
We'll live and treat you to lunch.
Well, that's what I was going to ask. Can anybody come or just Rotary?
Well, if everybody came, we probably couldn't treat everyone to lunch. So we
We
would
have to bring our own bag lunch then.
Well, no, not necessarily, but the actual programs start at usually 12:30.
Okay.
So if somebody wanted to come at 12:30 to listen to a program, I think that would be great.
Okay.
Anybody on this group, I'd be happy to foot the bill for your
I
lunch.
just think it's important that we show support for
Mm-hmm.
what Wanda and what you're doing from this committee standpoint,
Mhm.
more than anything.
Absolutely.
There'll be others that'll be joining and doing programs for Rotary. So
Is Rotary looking for new members?
always.
There you go, Bob.
I've been trying to talk Bob into that for 21
I got
years now.
stretch marks on this arm, behind the back. He's worked on me.
Yeah. Hello, wall.
That is a song,
Yeah.
Old generation, but it is a song. So, anything else on that? We good?
I think we're good on that.
Okay.
We're looking forward to the presentation.
Okay. New business.
So I just wanted to give a brief update on the status of this year's drawdown. As everybody knows, the last 2 years, we have seen some pretty significant impacts to our water. Last year was better than the first year.
Yeah.
This year is actually going very well. Part of that is because it was so dry this year. So the reservoir was naturally drawing itself down over the summer, so it wasn't so dramatic this year. We are in the actual drawdown right now, but again, it started so low. So again, it wasn't so dramatic. Conditions are a little bit different this year compared to the previous 2 years in that because it's so dry, we're probably going to hit the target level sooner, which is good. But it also means we will probably go below the target level because there's not enough inflow to hold it. So they draw it down to 780 feet and try to keep it there. They're probably not going to be able to keep it at 780. But this year, it's only a 2-week holding, whereas the last 2 years it was supposed to be a 30-day. So if we hit it, we were supposed to hit it December 1st. I think they're projecting we're going to hit it about a week early. So then they'll hold it for 15 days and then just allow it to refill naturally. So barring anything totally nuts, this year might actually be, again, knock on wood,
Have a
okay.
big public outpouring.
Yes. So,
Pun intended on the
just
outpoint.
pray for no atmospheric rivers in the next 6 weeks, because that's the only thing that could really do an uptick in turbidity at this point.
I went
So,
up and checked it out yesterday just
It
because
looks
I thought,
so
what's it
different.
going to look like?
Yeah.
The river was green. It
Mhm.
wasn't brown. It wasn't anything like the first
So
year.
it's that far down. I haven't been up there.
Oh, it's
Mm.
down very close to its lowest where they
Yeah.
were hoping
We've
to
we've
get.
got a little bit less than 20 feet to go.
Yeah,
Oh, wow.
Yeah.
but it is down, and
And that'll be a less impact on public works.
Big
with what they
time.
have to do.
Yes, big
and
time.
the
We
equipment.
Yeah, exactly. And so we had done some fine tuning in between the first two and then again between last year and this year, but it looks like we may not even get to test that, which is okay.
Yeah.
So, yeah, and they test throughout the day at the intake at Foster, and we're not seeing the spikes like we did the last 2 years. So that's a big relief because that's what puts a lot of stress on the system and on the operators.
It was pretty interesting. I was in Eugene last Friday. I had to take my wife down there for some laser surgery on her eyes and was sitting in the waiting room. There's about probably 5 or 6 of us here. And I was talking about the drawdown to my friend that went with us. And this lady across the room from us says, I could tell her she was interested in the conversation. Says, you don't mind me asking, what is a drawdown?
Yeah.
You know, and it's funny, Bill, who went with me, kind of as a backup driver in case I got in trouble with my blood pressure, but he happened to have pictures of it. And I said, well, if you don't mind me asking, where are you from? She was from Florida, but the concept, the vocabulary, she didn't understand it, but when they showed the pictures, oh, I understand a drawdown now. So said it's not like a hurricane like you guys have, but
Mm.
it's a different type of drawdown. So, well, thank you. I appreciate that.
Before we leave it, could I ask a dumb question from a dumb person?
No, you're not
Yeah.
You're inquisitive.
How on earth do the salmon get up over that big old giant dam?
They jump really hard.
And I mean, isn't that the intent was
You mean going back
we're
up?
supposed to be, trying to.
Well, so they were trucking them historically. Part of the intent of the drawdown is, I guess, the salmon that they're trying to save, they prefer to pass through at lower depths. So the intent is to force them down with the lower water level, and that's supposed to be better for their breeding. But the counter to that with lowering the levels is that the water temperatures have gone up to what are known to be lethal levels.
Yeah, millions of fish
smolts.
dying.
So it's very much still an experiment.
But they had an intake.
Fos-
The fish collar.
Foster has a
They
fish
have-
collection.
They have a fish
But-
collection.
Neither one of them have a ladder. They're too tall. Green Peter especially is way too tall for a ladder. So that's why they're trucked. They're caught in a collection facility below and then trucked above the dam.
Okay.
So what advantage is there to drawing it down if they can't get up it anyway?
Well, I think the plan is still to manually help them up, but the issue has been them getting down in the first place to go out to
Okay.
the ocean. What's interesting is this year, ODFW did stock a bunch of kokanee, so they are looking to see if any of them survive this time. It's not looking super promising, but there has been an interesting return of sockeye. So they're theorizing that some of the kokanee that were flushed out 2 years ago made it and are coming back now. So that's been an interesting turn of events.
Yeah, how long does this experiment take? What's the?
Well, right now, forever.
Yeah, there's no end date.
Yeah.
Yeah. So,
Okay. Like I said,
Fair
the
question.
dumb,
You
dumb
accept-
questions.
No dumb question.
Well, the whole thing is dumb if you ask me. That's
Strike that one off there.
I was going to say, I'll remind you that we are recording.
I will
When I do that,
gladly
hit-
tell them
when I do
face
that,
to
just hit the
face.
mute button, would you? Okay. Just committee business for the good of order. I do have down at a December meeting, but I wanted to talk a little bit. I had put some thought, like I always do. We talked a little bit about the effectiveness of our meetings and what we do as a committee. And I thought, closing out the year, I want to kind of touch, and I want us to kind of, and with your blessing as well, stretch this committee in their thinking. And, historically, we've put a health fair on, and had community engagement that way. We've been focused as a committee so much on what are the resources we need in Sweet Home? Do we have clinics? Do we have dental? Do we have clean water? Do we have these things? But I got to really put my thinking cap on that we're focused on the aftermath and not so much the beginning of the root cause of some of these problems. We've talked about mental health. And again, we go back to looking for resources. So through the holidays, I'd ask all of you, before we come back next year, is to think about what is a good, effective health committee and what are the things that we can be more involved in and that. And I wrote down what makes an effective health committee. And of course, the first thing I had on there was a diverse membership, which I think we have that sitting here today. We have a diverse membership. Just representation from various sectors, healthcare, community organizations, and local government. And we have that, making sure we have clear objectives, specific measurable goals that improve public health and address community needs. And I'll send this out to you to kind of, this is just my list, so you can always add to it. Community engagement, which we've done that through the health fair. We're doing that through some of our outreach. It's involving community members in discussions to reflect what their needs are. We kind of did that with the students when we went out and did our survey. So to me, that's a value add. We're already kind of hitting on that cylinder. Collaboration work with outside and inside organizations, leadership, and stakeholders to leverage their resources and experience. I think that's something we've been touching on, but it's always an opportunity for us to continue on that. Evaluations going back towards periodically times through the year. Are we doing what we need to be doing? Are we hitting those goals, or do we need to make recommendations and adjustments to what we're doing and not just take it per se that we had a list of these items? I get my fingers, my neuropathy to get these pages apart. And then I looked at what are some of the challenges of a health committee. Funding, of course, we don't fund a lot of things, but we do have a small budget. But how do we use the budget we have? And if there are occasions where we need maybe more than that, how do we tap that resource so we can expand that? Staff shortages, of course, from the support staff we have here. It's always a challenge for them to be here at all times. How we conduct our meetings and schedule them. It's important. Community engagement, again, going back and how we engage in the community, and get feedback. Policies and regulations can always obviously be a hurdle at times, what we can and can't do it. Cultural differences in the community, and health not being prioritized or seen as a value at all levels, because, health committees, there's basically kind of new to a lot of communities, especially smaller ones. I mean, some of the big cities have them, but they're more on a government-based type instead of a like this. And transforming leadership at all levels. We talked a lot about, the challenges with city council, for instance. Do they see this group as a value? And I think it's up to us to learn to maybe educate them on a vision, help them set maybe some of their goals. And as I drop it down a little further, I think it'll tie into what I'm talking about, because, what is considered or seen as health and what impacts the health of a community. The top of my list was education, and we just hit on that, educating people in the public, the school district, and all levels, even the workforces that are out there. The environment inside and outside of the home impacts youth and families. Financial security, jobs in the community, that really impacts the health of a community. Affordable housing, we talk about affordable housing, and I'm sure it's on the cities, but again, from a committee, those are things that we've never really touched on from where we sit. to consider that. Nutrition, we've talked about nutrition. I don't have all the answers for what we would do with nutrition, but we do have outside resources. We're talking about nutrition this time with SNAP, but look at it a little deeper. I know there was an initiative when I was manager that we just changed out things in the vending machines that was more healthier than all the cinnamon rolls and everything that was packed in there. So we made a small shift. I didn't get pushback from the employees. I got pushback from the vendors. They didn't want to sell apples and oranges in their vending machines. They wanted the donuts and the vending machines, they wanted them inside the lunchroom where people were staring at them. So I learned a lot with that one. Public safety obviously has an impact on health of a community and healthcare. Something as simple as a sidewalk that's broken or busted up and something falls or someone falls and hurts, it's a health issue.
Or non-existing.
Or non-existing. Street conditions, it all ties in. Tobacco control is one out there I saw a lot, and I'm not sure how we stop that. I watch people's buying habits lately in the stores, and it's kind of funny because I go into Safeway, and for tobacco, it's up at the front, but I never see anyone getting tobacco there. But I go to Thriftway, and never fails, I'm in line, and there's 2 or 3 people in front of me getting tobacco products. And I don't know if it's because Safeway is more of an elite store or something versus Thriftway I'm just saying that, more people that have limited incomes maybe shop here and it's more easier. I don't know.
Where are the tobacco products located? Are they at the register or do they have to go to the front of the store?
The Thriftway, they walk away from the register over there. So you're waiting for that person to go over there to checker and get it. And it astounds me the cost when people I was standing behind a guy and he bought 6 cans of Copenhagen Chew and it was something like $50. And I about fell over backwards. The choice was, and I think then he had a energy drink or whatever that is. Plus, I go, interesting nutrition choices, but it was there. It's just what it was. And the last thing I had on the list was just transportation. And I think Sweet Home, we do have transportation out there. So that system. But again, my point being
I
is,
think it's still even with the systems we have in place for transportation. I know I've had patients that have a hard time getting to our office because they either can't they don't have $1 lying around to utilize the bus, or they don't qualify for Rideline. And then with the changing of Samaritan losing the Medicare Advantage plan that they have, they won't qualify through Rideline through that. And so I think them getting not just to their appointments here in Sweet Home, that might be only 5 minutes from their house, but when they have to follow up at the specialty clinics, and if they have United Healthcare and they aren't able to be seen at certain like health specialty clinics around here that don't take United Healthcare, they have to travel to Eugene or Salem. I think transportation, at least from what we're seeing reported by our patients, and maybe you guys too, is one of the biggest barriers to them being able to access basic healthcare appointments. And without allowing telemedicine anymore, I think it's just going to be a bigger issue if people aren't going to be able to get in, talk to their providers, and get their medications. So that's something I really worry about.
It is definitely an issue.
Yeah.
It's one of our highest social determinants of health. And we actually have vouchers for our patients, or if we have someone that we can give them the vouchers for the shuttle so that they don't have to pay for it. But I would say even like the veterans who live in our community, they have no coverage for transportation. So if they need to go to a specialty appointment, and then even though our shuttle does go to Lebanon Hospital, they have to be dropped off at certain places. If they're not mobile enough to walk a block, then it really isn't helpful to them. It's a challenge.
Yeah.
especially even if they have to go to a specialist somewhere. I mean, just like my wife to Eugene, how many people here is going to have the luxury of just
Right.
going to Eugene? So you opt to not do that, So, I mean, just that alone might be something, in next year, we really look at transportation throughout our community and where are the cracks that we might be able to fill in to help that. The voucher is an interesting one that you have.
Well, they actually were given a grant, so they have a certain number of vouchers for, and they're supposed to be mainly for elderly and for veterans, or disabled folks. So, but we're also allowed to use them for anyone. Most of ours are elderly patients. Because the elderly patients are the ones who do not have transportation coverage through Oregon Health Plan.
And I think what you touched on right there, for us as a committee, the grant piece, there are grants out there, but we don't think, at least I haven't really thought about grants as being an opportunity for this group to start tapping in to get grants maybe for nonprofits and other organizations that need that. So, that might be a good one just to look out their grants. I mean, I looked at one just through our church the other day and I got, why are you not applying for this? It was $2,500 and it was the Greater Northwest of the Methodist little group, and they were giving out, $40,000 or $50,000 to churches, but each church could apply for $2,500. And I thought, why would you not do that? I didn't get an answer, but I think it's because people aren't really knowledgeable on grant writing and how that process works. And sometimes grants are pretty easy and others are a lot more detailed. So that might be something to put on the list here, is for us to kind of look at what grants are available out there, because there are a bunch of them, and we should take advantage of that if we can. That's the funding piece of it on that. So,
Well, unfortunately, our city council member that sits with us was in charge of the transportation department for many, many years in our community, and he knows a lot about grants for transportation. And he still has very close ties with transportation in Lynn County. So maybe inviting the current director of the transportation department at the senior center sometime to come and talk to us about what could they be doing, what are they doing, and what could they be doing better.
and I know those that provide grants. I know when I did the Sunshine Project, we put in for big grants and we got money, but each of those groups, like the Ford Foundation, Collins and them, they have grant writers that will help you through that process. So a lot of times you don't just have to wing it. We brought them in and they just came right in and said, this is what we want to see. And this is the things, how to say it and not to say it. And it was very beneficial just to have a professional group like that. They want to help you. They don't want to just, so there is opportunity there now. So
I would share that in our community, I think education about the Lynn shuttle is extremely important because patients do not know how to use it. There are certain buses that come right to your door. There are other buses that you have to ambulate to them. There are some buses that only make specific stops. There are others that can come into the parking lot to drop the patient off. And sometimes it takes coordination. If they live in Lebanon and they're coming here, they can ride one bus to the senior center and a smaller bus to the clinic, but they don't know that or understand it. And it just has to be arranged ahead of time. So I know we've had them present at our clinic to our staff, and it is really helpful to understand more, but I don't think people really in the community really understand it.
Well, we've talked numerous times about trying to do presentations to our community. Maybe that's a good topic for one of them. And maybe not just talking about it, but actually organizing it to happen.
not necessarily point smart, you have a monitor in your city room. Do they display that kind of information? I'm trying to think of what's an educational tool you could use. They're all sitting there waiting for an appointment. And there it is. There's a schedule and how to use it.
Anything that is on our monitor has to be approved through marketing.
Give me their number. Well, I mean, I was in Safeway here not too long ago to get a shot, for the flu shot. And I was sitting there and I'm looking at this monitor, is just black. There's nothing on it. And the manager came in. I said, by the way, you have a monitor. Do you use it? Oh, it hasn't been working for so long time. And I'm thinking, well, who's your manager? Because I want to talk to them because they just didn't have the time and the energy to take on the monitor. I thought, but you've got your audience sitting here. And what freebie is there than that? thing, you know?
That is a partial audience.
Yeah.
You also tend to tune that out
Oh,
at
yeah,
times.
yeah.
But
Yeah.
I think that we try to educate our patients when we know they have a struggle
Yeah.
with transportation. We try to help them. We have schedules, but it's still a challenge. You
And-
can't
and
reach
it-
everyone.
Makes me wonder how many of the other services out there that provide that same discussion like you do, you know, are they all doing the same thing? Or are they just taking for granted that people know how to use it? So that might be.
Well, we honestly didn't know. We didn't know the difference between the buses.
Yeah.
Because when I called to talk to them, it was after someone had a fall outside of our clinic who was dropped off on the sidewalk and was visually impaired, but they were on a bus that they could not come through our parking lot. So, you know, we discussed it and it's like we didn't really understand how it worked, what the difference was or what they needed to request. And so,
Well, and I think on the city's website, it lists out the different transportation options and it explains what the shopper does, what the
Mhm.
shuttle does. And I know because I have copy and pasted it and put it into letters that I'm sending to patients along with Albany has a service, volunteer caregivers. And if they have a volunteer, and sometimes it's just like a one-off, we're able to get a hold of someone and they're willing to come to Sweet Home, but it's pretty, mostly our Lebanon patients can utilize that. And then Community Crossroads in Lebanon has a vehicle that they do transportation and it's free within Lebanon, but then I believe outside, if they have to do a pickup or drop off outside of Lebanon, that's when you would start to incur a charge, or at least that's how it was when they first launched it. And so we provide those resources. We also can do limited transportation, but I'm currently the only person at our office that's doing that. So that's not an option for much longer for people. So that's kind of why I worry about it is I just know we have a lot of folks that there's certain treatment they no longer will seek based on the fact that they can't get there. And so they're not pursuing cancer treatment and kidney failure and other things that are ultimately going to be why they are no longer with us because it's such an insecurity out there.
Yeah.
To get to appointments.
Plus, I think beyond the transportation is just health insurance.
Yeah.
What we're hearing that could be coming, and that's going to change the whole picture again. So, okay, anything else?
Is there a December meeting?
Well, that's what I'm getting to.
Okay, I'm sorry.
It's right there.
You can run the meeting.
That's actually the question I had. Because I was proposing that, you know, with the holidays, we're winding at the end of the year that we do not have a December meeting and kind of give everybody a little bit of a break, especially busy time at the end of the year. And so I'm throwing out this group. Are you comfortable with not having a December meeting?
Yeah.
Probably are for sure.
Yeah.
No,
How about you, Dick?
I'm fine for,
I'm okay passing on it.
yes.
Well, we'll pass on. Do we need to vote on this or can we're just going to say no December meeting then? So.
I just have one other thing to add.
Oh, yeah, absolutely. I was going to close out with anybody had anything else they wanted to add?
I went to that Reformed and Ready training class that they had over in Albany, and it was presented by I don't remember the name of the organization, but anyway, they talked about different types of emergencies, and that 17% of the people don't have a plan at all for an emergency. Like if there's a power outage, you know, with heat or cold, or excessive rain with flooding and stuff. So the goal of them was to make us aware, the people in the audience. And Sean and Jennifer from the police department were there also, as well as Dawn and myself and Mariah, who's the president of the board. And so it was interesting, really made us aware, and having an emergency pack available, ready to go, and how to, you know, stay safe when winter weather threatens. But it wasn't specific to any particular community. But they did talk about things to be aware of. And if you're dealing with people who are either elderly or have physical disabilities or mental disabilities, that these are things that they may need help with and that we could set up, or the community or their caregivers or whatever could set up. So it was kind of eye-opening in that respect.
Yeah, it usually comes down when the emergency is when they think about it.
Yeah,
Mhm.
exactly.
Yeah,
Not to
yeah.
be ready ahead of time with little to-go bag.
So how would you see that going forward with that information?
I just think that somehow, and again, I'm not sure how, having it available, having the information about cold weather threatens. The senior center, Mariah does the bulletin, and so she was talking about maybe putting some of this information in the bulletin that the seniors pick up about the senior center, that cold weather's coming. These are things that you should be aware of and do. There's an emergency list kits that they handed out. There's a lot of stuff that they gave us information, but it wasn't specific for Sweet Home or Albany.
Yeah.
So, but anyway, we're thinking about incorporating it into our newsletter this winter.
That just made me think of like cold weather. Are the shelters, the warming shelters going to be operating? And what is the like guideline that the city uses based on like if it's below a certain temperature, then these spaces are open or
So City Hall and the library are only open during standard business
Mhm.
hours as warming centers. PD, you can pretty much go 24/7. If it's after business hours, you just have to ring the bell to ask to be let in. To be honest, we've talked about setting a threshold. We don't have one established, but again, the lobby is technically available 24/7.
And then I know there was talk in the past about getting a generator.
The senior
somewhere.
center, yeah, they're getting one installed.
Oh, okay.
Yeah.
But is that not an established thing yet?
Not there yet.
Okay.
Yeah, so there was some turnover at the county. The county was leading the effort and there was some turnover. So I literally just got a fresh contact last week. So he is trying to figure out how they were funding it.
Okay.
Mm.
Perfect.
Anything else?
I have
for the-
more, but just not about that.
Sorry?
I said I have more, just not about that. So I
Okay.
was waiting if anyone had anything else to add to that. Last year, I want to say before April, we had to give a presentation to council. Is that still?
Well, you're the good committee because you're the only ones that give the presentation you're supposed to give. So that would be wonderful if you would do it again.
When-
I think it was just due before April. So I
Yeah,
think we ended up
and-
doing
Right
it
after
like March.
the year there.
Yeah.
Oh yeah, between April and June would be fine. It's just kind of to
okay.
wrap up the fiscal year, summarize what
You'll
you've
get ready
done.
by then.
No, I think before April would be a good deadline.
I mean, I can,
Keep us right on track with last year. So I think if you would do it really well. I can send you what I have from last year and you can just
Yeah, it was a good,
tweak it.
I'm sure.
good
we can figure
base.
it out.
Um,
We can do that.
And then since we're going to skip December, just to keep it on your minds, I know last year there was some talk about goal setting. We are probably going to start floating the idea of goals very high level to council in December, just kind of catching them up on where we are on current goals. But we're probably going to start goal setting with them in February or March. So I would again encourage the committee to get ahead of them and come to some consensus on things you'd like to suggest for us to bring into their goal setting rather than waiting for them to propose and then trying to get in at
That
that
goes back
point.
to what I was talking earlier of educating
Mm-hmm.
leadership.
Mm-hmm. So once we firm up that timeline, I'll definitely make sure that we
Get
have
that-
that
yeah,
discussion.
Get that out to us. then
Yes.
We can definitely pull something
Yeah,
together.
so we're not behind the ball.
Well, then it might be good to do a presentation early and then at the end of the presentation, present to them some goals, health goals that they could adopt.
You know, for someone that's not going to be there, you sure are.
Just saying.
I
Might be a good
appreciate it.
idea.
Nope, I'm good. I'm good with that. Anything else?
No.
Okay, we'll call this one over.
Oh, what was that?
Okay.
That was so dainty and gentle.